You probably don't think about how important your legs and knees are until one of them is injured. That's what happened to one local student and athlete who was forced to stop the activities he enjoys.
I fractured my tibia and it, pulled away from my ACL, so I have a little ACL injury as well.
Alex Leotard suffered a significant leg injury that stopped him from doing what he loves, playing hockey. He faced surgery and a challenging recovery, but physical therapy made that process much less difficult.
Alex had a fracture to his tibial plateau, which is the bottom portion of your knee, or referred to as the tibial-femoral joint, that had to be fixated with metal, or referred to as an open reduction internal fixation, which requires an extensive period of recovery, beginning with early fracture care after the surgery with gentle motion, progressing to light strengthening, and eventually sport-specific activities so he could return to hockey this January, which was his long-term goal.
Aaron Mazza is a physical therapist with Dynamic Physical Therapy. He says that while each patient is unique, the type of leg injury that Aaron had is not uncommon.
This kind of injury, fairly common. You're going to see it in higher level athletes. You're going to see it in victims that have been involved in a motor vehicle accident. You're going to see it in some slip and falls. You're going to see it in some folks that have been diagnosed with osteoporosis that actually have bone diseases that render their bones more fragile. But you can see it in a wide variety of patients with a wide variety of mechanisms of injury.
In the past, a patient like Alex might have been mostly on his own during the recovery process. But modern physical therapy techniques and exercises got him back on his feet much sooner.
There were some initial exercises that we started, and it's generally going to involve the same progression with range of motion, then progressing to light strength, and then progressing to more advanced activities like jogging, biking, cutting, sport-specific activities once he's able to do that. Once he gets to a point where he's able to return to sport, usually the activity they return to, in Alex's case, hockey practice, is in and of itself the primary activity that he's back to doing.
Even though it took a half a year to go from the operating room back to the hockey arena, Aaron says it would have been much longer if not for the expert therapy.
Very efficient recovery for that kind of an injury. With him, we were probably closer to the 5-6 month time frame from surgery to full return to sport, which is a very desirable time frame.
And Alex seemed to agree.
After surgery, physical therapy was fun. I had fun with it. Everything worked out fine. I'm doing good now. Back into hockey.
For My News 26, I'm Kayla Kiley.